So good afternoon, everyone. Welcome to the MHA Hospital Bond Program webinar. My name is Jane Krinke. I'm a legislative analyst here at the Maryland Hospital Association. And joining me today, I have Sarah Swam, who is our consultant with Schiavi, Wallace & Rowe, and Matt Pace, our Director of IT and Operations. So you'll be hearing from all three of us today. And this is an informal webinar, so feel free if you have questions, you can put them in the chat or raise your hand as we go through the webinar. We will have time at the end dedicated for questions, but if you have anything that arises as we're talking, feel free to hop in. So this is kind of an overview of what we're hoping to cover today, a broad review of what the bond program is, and then a step through the scoring and selection guidelines, and then each of the schedules, as well as some important dates. And then Matt will give a demonstration on the SharePoint site. The entire process is electronic, so he'll walk through those steps. And then we'll talk about what happens after this, like how to start your application process. So just to give a brief overview of the program, the Hospital Bond Program has been in effect since a work group established it in 1993. It's an opportunity for private hospitals to access state funding for capital projects. And we have a review committee that comes together of 11 members, a mix of hospital trustees and hospital executives that are not reflective of the hospitals applying. So if you're an applicant, then you're not eligible to be on the review committee. And we make sure there's diversity among the regions represented, independent and systems, hospitals that are independent and part of a system, as well as diversity in the state. And so the capital budget process is really kind of a year-round endeavor. This is a little blurry, but you can see the application cycle, we open it up in March and it will last until June. We have presentations in August, and then the review committee makes a determination based on the applications, which projects should be funded and the levels. And then we provide those recommendations to the Department of Budget and Management, which presents the recommendations to the governor. So these capital projects are actually included in the governor's capital budget when it's introduced in January during the legislative session. And so it goes through the process from January and February. The MHA team testifies when asked before the budget subcommittees and advocates that the recommendations move forward as recommended by the review committee. And then in April is the end of the legislative session, and hopefully the capital budget must pass. I think the deadline's usually in March. Around this time, actually, they're finalizing their decisions. And then the funds actually become available for your use June 1 of the year that you apply. So June 1, 2023. And we'll walk through the specific dates for this application process. This is a very kind of busy chart, but it gives you an overview from start to finish. This blue section isn't applicable to this program because MHA, we advocate on your behalf instead of you having to go to an individual legislator. And so really after you're approved for funding, you will work with the Department of General Services and the Comptroller's Office to sign the grant agreement and go through the state process. So we do a lot of vetting on the front end so that you have a smooth process through as the capital budget passes through the legislature. And just a quick overview on the timeline and process. So applications will open up this Friday. We'll make sure you have access to the link. Everything's online, like I said. April 29th is the first really important date. So all of these projects generally do not require a certificate of need, but we ensure that we go through all the process steps. So we ask that you send a letter to the Maryland Healthcare Commission requesting a determination whether your project requires a certificate of need. And we need that letter to move forward just to make sure we're not violating any of the rules of the program. So there, in rare circumstances, a project that would require a certificate of need could be funded, but generally these projects are not large enough. We have a pretty small budget. We will have 7 million allocated for the FY 2014 cycle. So, and a $1.4 million cap on all of the projects. So they're smaller and usually don't require a CON. So final applications are due in June. And then in early August, we'll have 15-minute virtual presentations where you'll be able to really bring your project to life and answer questions that the review committee may have on your application. And then in mid-August, we submit those recommendations from the review committee to the governor, Department of Budget and Management, and other staff engaged in the legislative process. And then kind of like I said, throughout the 2023 legislative session, we shepherd these recommendations to ensure that the amount the review committee recommended stays true, that they're not cutting projects and things like that. And then, yep, so June 1st, these funds would be available. Any questions so far? I stepped through that pretty quickly. Okay. Yeah, like I said, feel free if you have questions. This graphic, Sarah created last year just to kind of help with timing. So the state really likes to have these projects be as shovel ready as possible. And so you can kind of see the green is the planning costs and the construction costs. And there's kind of a sweet spot where a majority of the planning and a majority of the construction costs should occur. If your construction costs are happening too late in the fiscal year, so if you wouldn't start construction until, you know, the end of the calendar year of 2024, then the state might hesitate to approve a project this year, despite the merit, just to ensure the funds are issued as close to when they're going to be expended as possible. Each of these grants have a 7-year life cycle. There are opportunities to extend, but the state likes to have the projects, you know, funds expended in that 7-year time span. Sarah, anything else you'd like to add for this graphic? I think it's really helpful to visualize the timing.
I guess the only thing to add would be, you know, look at that, the construction cost, the dark orange area. That's, Jane already said it, but that's basically where you want the bulk of your construction to take place.
Thank you. Yeah, super helpful with the calendar year and the fiscal year, because it is kind of confusing when you're trying to map out your timing. But any questions on this piece? Okay. So next, just a little bit more about the certificate of need determination. So based on the state regulations, a certificate of need is required if a proposed project exceeds the capital threshold, which is currently 25% of each hospital's annual hospital revenue, or $50 million. Or if it's categorically required, if you're changing bed capacity, establishing a new service line, or increasing operating rooms. Like I said, these bond projects typically do not require a CON. And that's why we have, you know, those letters sent to the MHCC. If you are requesting a rate increase, we request that you also send a letter to the HSCRC. And then all of those two letters, one letter for sure, but if you also have one for HSCRC, are required to be included in your application and emailed to us as well. Just to ensure you're not investing time in a project that won't move forward, we like to have these determination letters early in the process, just in case MHCC asks questions or you know, you figure out the project isn't a good fit, then you're not having to go through the full application process. And then for that letter that you'll submit to MHCC or the HSCRC if applicable, we have some template letters we can share with you. They like it to be very brief and to the point with supporting documentation provided. So they ask for a concise project description, total cost of the project, whether bed capacity will be changed or a new service will be added. And then they also request that these letters are sent in Word just to make it easier for them to give you a response back. And there's a new point of contact at the MHCC, and we'll provide their email address once we have that confirmed this week. We'll get that to everyone. Yeah, and just the footnote, if you are requesting a rate increase, then you'll need our approval from HSCRC. So any questions on the CON portion or requirements? All right. And then scoring guidelines. I'll hand this over to you, Sarah.
Sure, yeah. And just real briefly, I'll introduce myself. This may be repetitive, but hi, everyone. I look forward to working with you. And just to let you know, I will be here along throughout the process. If you have any questions or concerns, you can reach out to me. Jane will be providing my email address and my phone number so that you can contact me. And I will review your application. I can help you before your application, and I will review your application after you submit it as well. I make sure that it's complete. I'm not looking at the content as much, so I'm not going to be scoring this or have any say in what gets approved and what doesn't, but I will try to make sure that you have everything included in your submission packet that needs to be there. And if you are missing something, you know, and we're at the June deadline, you submit it and you have some things that are missing, then we'll give you a little bit of extra time to get that in, so you don't have to worry about that. Okay, so scoring guidelines. Back to the slides. The scoring guidelines, and we're going to see the detailed scoring guidelines below. This slide right here is just a couple of the highlighted items. The projects should align with the Maryland model. They should be hospital driven. The unmet need criteria should be related to the local service area. You'll see a little bit more about all of these below. And serious consideration will be given to projects serving health professional shortage areas or medically underserved areas. If we want to scroll down to that detailed guidelines.
Yes, and one thing just to pop in here, I forgot to mention it, but because this came up recently with a hospital that had applied in partnership with a community organization, and they ran into some issues receiving reimbursement. So just if you are partnering with a community organization, that's fantastic. But you have to make sure that the hospital is being viewed as the grantee, that they're making most of the expenditures. But if you have questions, we're happy to walk you through that process. Back to you, Sarah. Sorry about that.
No worries. Okay, so the scoring guidelines here. I'm not going to read through this. That would take up this whole session here. But I want you to know that this is very important. This is the bulk of how your project's going to be scored. This is what the committee members are looking at when they are deciding who gets funding and who doesn't. So, you know, you're going to want to read through all of this in detail. And you are actually, and I'll get to this a little bit later on, but when you submit Schedule 1, you are going to use these scoring guidelines to tell us about your project. It's going to look just like you're going to hit on all of these points in your application. So the first thing on the scoring guidelines, improving patient care, this is where the bulk of your points really come into play, probably about 20% of your points. So you want to really address this section, make sure you fully cover this area. I'm just going to go through very briefly. So Jane, if you want to just scroll through. The unmet community health needs. You're probably going to want to include some excerpts from your community health needs assessment. Your project should, most of the time, it should align with that. So that's something to keep in mind. Alignment with the Maryland model, we already mentioned that above. Improve the patient environment. This is a section where you want to, this is also a big point section. You want to make sure that these improvements are multifaceted, that there are different ways that this is going to impact your patient environment. If you want to keep on going down, let's see, the last renovation. This, the little chart's very helpful here. It tells you exactly how many points will be allotted. So you'll know right away if your renovation is less than, you know, if this is an area that hasn't been renovated in 15 years or more, you're going to get 20 points. This is a quick way to get some points right away. You want to pay attention to this chart here. So community provider, that's pretty self-explanatory. Number 7, underserved areas. This is an area where I want to highlight a little bit because you want to have something to support this. You can support it using the health professional shortage areas, medically underserved areas. They're out there posted, so be sure to include this in your application if it applies to you. Statewide and regional significance is also, you know, pretty self-explanatory. And community partners, Jane already kind of hit on this. It's good to have community partners in your project, but you also want to make sure this is a hospital-funded project. And then demonstrate community financial support. You're going to get the most points here if you already have financial support from the community in hand at the time of your application. But if you don't, then please try to include something to prove that you are receiving it. Some people just, some applications sometimes just say that they expect to receive 5%. But please try to have something to support this in your application. And committee discretion. This is something that was added just a couple years ago. Each committee member is allowed to allocate some of their points based on how they feel about a project, where they feel points should be applied. So kind of, you know, this is more where a project that tugs at the heartstrings is going to get a little bit more points from the committee than something that doesn't. So that's important too. Right. And then Jane, did you want to talk about the funding request here?
Sure. So we try to, just to ensure the amount of funding we receive is spread as widely as possible, we do limit total hospital requests to 20% of the budgeted amount of the program. So like I said, next year we'll have 7 million, which we've never had that much for this program. It had been at 5 million for, you know, several, 20 years. And so we've been slowly increasing just because the legislature has really seen the value in the projects that we bring to them. And they know we have, you know, a credible vetting process. So I think this is a testament just to kind of how the program's been growing and it's positively viewed. So projects scoring in the top quartile will be recommended at the requested amount, which is a max of 1.4 million. And then each of the other projects are usually recommended using a sliding scale. Projects that score less than 60% of the total points may not be recommended for any funding, just depending on the discussions within the review committee. We really try to make it fair for those that really invested a lot of effort and thought into their application, that they're, you know, rewarded accordingly. The other thing to note, I think anything else here, Sarah, for funding request or allocation?
No, I think you're good.
Sorry, I just thought of it. So there is a state requirement that you cannot request more than 50% of the cost of your project. So that's another cap to think about too, as you're putting in your request. 50% is the max. And any questions on what we've covered so far before we kind of dive into the actual application documents. And I'm going to pull up, stop sharing my screen for just a second. So these documents, there's 2 Word documents and then a Excel spreadsheet. I'll just show you them so you can see them in what they'll actually look like. Okay. And then I'll turn it back to you, Sarah, to like walk through.
Yep. So Schedule 1, this is where the meat of your application is. This is going to take some time. You're going to need input from other people in your facility, I guarantee it. So, just, you want to spend the most time on this, you're going to spend the most time on this. I'm going to just hit on some of the areas that are more important than others, but if you have any questions about how something should be filled out, feel free to reach out to me again. So, if you're not sure how to look up your GPS coordinates, which I don't think that's going to be a problem, I'm just using that as an example, then feel free to reach out to me. But I wanted to, if you could skip down to 5A, I believe it is. Let's see. 5A. So this is the project synopsis. This is going to be very brief. It says right in the description here, 3 to 5 sentences. This is going to be something that is just going to be a quick overview of what your project is and what you plan to do in your project. That's actually the key. As you can see, it begins with a verb. So this is an action. What are you doing here? If you want to go down to 5B, here is a full description of the project. It highlights here, bullet points, what you should include in your description. So you want to pay attention to that and make sure you have all of this included. This is something, it says not to exceed 3 pages. So it's going to be a lot in here. You want to include as much as possible because the committee members, sure, you're going to have time to present as a presentation, but they want to already know what your project is before that presentation. So you want to try to include as many details as you can in this 3-page area. Another thing that we added last year or the year before is photos or plans of the project are helpful. The committee members actually really like to look at them so that they can visualize what you're doing. You can include them as an attachment, and we'll make sure that the committee members have that prior to scoring your project. So I just wanted to point that out. Any additional thing that can help them visualize it is great. And if you want to scroll down, number 6. This is the section where most of the scoring comes in. So the scoring criteria that we looked at earlier is what you are going to use to fill out this section. I would say pretty much all of our applicants at this point format this in an outline format and use the scoring criteria to complete this section. This makes it much easier for the committee members to look at it and score because they're going to be looking at the scoring criteria, going through this section right here and marking off how they think you did in each of those scoring criteria. So, so that's something that just keep in mind, please. This is where the points come into play. You want to keep on going? Yeah, all of the next few sections are pretty much self-explanatory, more informational. And the age of the unit here in number 8, this is something where, we pointed out earlier that this determines some of your points. If the unit is older, then you're going to get more points that way. Prior funding in the past 10 years. If you have any questions as to whether or not you have received any MHA funds in the past 10 years, then you know, we can help you out with that because we have records. There's also, Jane has something posted out on the website, correct, Jane? Yes, that shows everything that's been funded. So you can pull it up there if you need to. And we have a lot of people who don't know that because I know that there is turnover. So you may think, you know, that it should be simple, but if you're new there in the past year, you're not going to know this. So we can help you with it as well. And then major capital programs in the next couple years, you want to fill this out. And pretty self-explanatory here. And number 12 goes over what Jane already spoke about earlier. This is the written assurance from MHCC and HSCRC if required. So you're going to include this. And I know Jane mentioned it, I'm being repetitive. You're going to include this in your application as well. And then number 13, the signed board resolution. This is something that has always been required, but we just added it to Schedule 1 here, just because it's kind of hidden in the requirements, but we will see it later. But you do need this, and this is something that sometimes you need to get started on a little bit early because I know, you know, the boards don't always meet every week. Sometimes maybe not even every month, as we found during COVID times. And then workbook Schedule 2 is going to be next on the list. That's number 14. I'll let you switch it over. There we go. The Schedule 2, this is just the numbers. It's all relatively self-explanatory, and the nice thing about this schedule is that if you have an error where something doesn't net, it's going to tell you. There are little edit errors throughout the workbook where if your total project cost in one section doesn't tie to the total project cost in another section, it will alert you to that. So, so that's helpful. But this section, if you have any questions with it, again, feel free to reach out. It's pretty self-explanatory, but I do want to scroll down and point out the dates here. So number 3 here, the start dates and finish dates. You want to make sure that when you're filling this out, you're going to look at the timeline that Jane showed earlier and make sure that your dates align with that timeline, because we don't want you to go through the trouble of filling this all out just to find out that your dates don't align with what the state wants them to be or has in mind. So I did want to point that out. And the next section, section 4, is just, you know, detailing out the cost by acquisition, planning, construction, equipment, if there is any, and by source. And here's your proposed completion schedule. Same thing, want to make sure that your dates here align with the timeline and align with the dates above. Operating budget. This operating budget is for services. This is for the change. So not necessarily, you know, your operating budget for your whole hospital. This is for the change from this project, related to this project only. And then if we want to scroll down, cost savings, a lot of times this is for tangible cost savings, but if there isn't necessarily a tangible cost savings, sometimes people use that little section below to describe why not, or to describe how they determined their cost savings, which were above. Do we have any questions on these schedules so far? I know Jane was doing really well about stopping and asking, and I haven't done that, so please let me know. Okay, I'll finish up this last section here, the ratio analysis, just some basic financial data that will need to be filled in. And then We also have asked, if you scroll up just a little bit more, there's a note there. Yes, there you go. We used to require the supplementary schedules from financial statements to be included with your application. They're not required anymore, but they can be helpful. So if you can include them, then please do so. And that's the end of Schedule 2. Schedule 3, this is a checklist. You want to go through this. I would actually recommend reading this, even though it's a checklist, reading this before completing your application so that you know what some of the common errors are, some things that you may need that you didn't realize before you started. So I would read it before and then use it after you're done your application before submission to make sure that you covered everything. I'm not going to read through this, but I did want to point out, if you scroll down, most of this is repetitive and we've already been through all of this in the other schedules, but I wanted to highlight, keep going. Here we go, number 3, the additional written assurances, because we haven't mentioned that anywhere else as of this point. These assurances will need to be submitted with your application. They will need to be signed. So this is something that you may want to get started on early as well. And then everything else is, like I said, these are just checks and balances. So I'm not going to read through it, but I would suggest that you read through it before even starting your application. Any questions? All right, Jane, do you have anything to highlight that I may have skimmed over?
You do an excellent job. And I think that previous applicants have just, sang Sarah's praises because she is really here to really help make sure you have the best possible application to present. And so, yeah, we're both available to ask any questions, but Sarah definitely has the content knowledge on the application side.
Yes. Feel free to reach out as needed, please.
I wanted to give just a quick, a bit of information about the presentation. So we transitioned to virtual during COVID and everyone loved that. So we are permanently virtual. So each applicant will have 15 minutes to present to the review committee. And like Sarah said, the visuals are very helpful. The review committee members read every single word in your application. So they have a good idea and they usually come with some questions about gaps that they might have seen or, things like that. So they are good students. And so this is really an opportunity for you to bring your project to life and help them understand why it's so important. And they're usually in early August, the first or second week. By June, we usually, before you even submit your application, we'll let you know when the date is. It's usually good, and we've seen that usually hospital leadership is there as well and principal partners involved in the project. And that's really helpful for the review committee just to see the investment the hospital has in the project. So we know to get some of those folks, you need a lot of advance notice and for your calendar. So we try to give you as much time as possible so you can plan. And then I'm going to turn it over to Matt, who is our IT guru and here to help talk about SharePoint and other IT considerations. And do you want to share your screen, Matt?
Yeah, thanks, Jane. I'll share it. Hello, everybody. Matt Pace with the Maryland Hospital Association. I'm the director here, and I will basically be here to support you guys through any technical kinds of issues that you may have throughout this process. Even if you might have missed an email or something like that, and you wanted to verify submission of your various schedules and or supporting documents, I will certainly be able to take a look inside of our system and let you know, and that you've successfully submitted. Upon letting us know of your intention to apply for the 2023 bond project, you will be sent a specific link that has, it's actually really easy. It's only for your organization. You'll just want to put that link somewhere because you're probably going to go back to it a few different times. Anytime you have something that you want to submit, you'll be using that link, and that link is going to take you straight to your specific folder where you're going to be able to deposit your files, your schedules, and your supporting documentation, pictures. Really, any kind of file will, you'll be able to upload. Once you go in there, you'll notice that, excuse me, you'll see your organization's name here. For this one, it's a test for presentation, but your landing spot will be in this application folder. And basically, all you want to do is you'll just click on upload. You can also drag and drop, but a lot of times it's just easier to click upload, and then you can select different documents and things like that. For this one, we'll just select basically everything in this folder. And then you'll see that there's an upload process going on here. Now that upload process, once the automation on the back end sees that there's files there, it will start going through each one of these files and sending you a receipt for those specific files. Don't be alarmed if you sit on this page and all of a sudden you see things disappearing from there. That's by design. Basically what happens is once the workflow is kicked off, it will go into another folder on the back end that you guys can't see, and that will be kept there for review. That's so Sarah can take a look at all of your schedules and things like that and verify that you guys have the proper information on those various schedules, and make sure that everything's good with your application. The file receipt will look something like this. So basically, it will come from either my email address or a MHA bond at mhaonline.org email address, but it'll have the same kind of information. So one thing we've added is a receipt for your specific file. So this is perhaps a file, or this is one of the files that I uploaded here. It'll say, thank you for your submission. This is just a checks and balances kind of thing, just to ensure that, you get notification that your file was successfully submitted. After that, you won't receive any other automated emails until your applications are being reviewed. And once that's done, there's either two things that can happen, an approval or a rejection. If your file is approved, you'll get a notification. There might be some comments that Sarah will put in there for you, but basically it says that this specific document, not the whole application, but this specific document has been approved and it's basically ready for committee review. If there is something found on one of the schedules that needs attention, you'll get an email like this that says there's issues with your application. It basically will tell you what the document name is, and then it'll have a link to your file that you'll be able to click on. And that's really more or less just so you can look at the file, but you can also download it and save it and make the necessary changes to that particular file. There might be some comments from Sarah. It might just say, that it's missing information and she might just want to reach out to you or give you a phone number there or whatever. But the application process itself, we've tried to make it as easy as possible to submit. You'll notice if I do a refresh screen right here, there's nothing left in this folder. Once you make a submission, you really can't go back and kind of take that submission back. What you can do is if you uploaded documents, as long as you keep the same name, if you bring in a document of the same name into this upload section, it will overwrite the document that might be sitting in the queue for review. So you'll get a receipt for that as well. And that's really it. As I said, there's some information in this PowerPoint, or what we're going over now, that has my email address as well as phone number, and I will be more than happy to help you with anything that you may need help with in terms of technical kinds of things. I will also serve as a backup for Jane if, let's say, you lose your link for being able to access the repository or where you're going to deposit your files. I'll be able to resend those if you want to reach out to me or Jane. And with that, is there any questions involving all of this?
Matt, I don't have a question, but I do have something to add that I should have probably said earlier. Mm-hmm. When you're submitting your documents, we would like it to be, we prefer that you submit 3 documents only. One is going to be the Word document that is your Schedule 1. One is going to be the Excel document that is your Schedule 2. And then the third document is going to be a PDF of all of the supporting documents for your application. So we'd ask that you submit it that way. It's much easier for us to review it that way. If you have a problem, say you wanted to include some photos and they were large or you couldn't get them into the PDF, and that's fine. You know, we understand that there are exceptions, but the preferred method would be 3 documents, the Schedule 1 in Word, Schedule 2 in Excel, and all of the supporting documents in a PDF. That's all. Thanks.
Yeah, sorry about that, Sarah. That is, I mean, there's been times we've gotten 50 pieces of documentation, and it really does make it challenging reviewing every one of those, kind of going back and forth. So that'd be much appreciated.
Perfect. Thank you both. And I'll share my screen one more time just to kind of go through the next steps. So the next steps in the process is to request that SharePoint site. So you're welcome to email me, and we'll make sure your hospital specific site's set up. And you can do that even if you're unsure if you will move forward with an application. It doesn't hurt for us to set it up. Then you're ready to go. And then, of course, you know, any questions about your project, you can email Sarah. If you're considering whether like a set of 3 projects, which one would fit best, you can call us, and we're happy to walk through with you through the process and kind of figure out which one would be best suited for the program. And then we also added some resources. So we have our website, which has it'll have the SharePoint link to the application documents, as well as other resources, the scoring guidelines, things like that. It'll all be linked on our SharePoint site. That'll be linked on our website. And then this is a link to the SharePoint site. And then the Maryland Capital Grants Project booklet kind of talks about the state side of the process. So there are certain project expenditures that are eligible and ineligible, like major medical equipment and things like that. So it's a good idea to check out the state requirements. We try to include that in our application process. But if you're curious about some of the very detailed, you know, expenditures, this is a great resource, this booklet. And again, any questions, let us know. And this is our team, our bond team. And so I'll open it up for any questions you all have. Again, in the chat, or you're welcome to unmute I don't think I have to do anything to unmute you, but let me know if you're having trouble unmuting. We try not to make this intimidating. So yeah, any questions? Do you have, Sarah, any tips or advice for applicants? You've been through this for several years now. So are there any things that first-time applicants should be thinking about?
One thing, I kind of mentioned this earlier, but those committee discussion points, you know, they added a lot. And I think that if you have a couple of different projects that you're looking at and you're trying to decide which one, that little tug at the heartstrings thing, that really does make a difference. I've seen it. People, you know, they want to find something to support that they're passionate about. So that's just my own little word of advice. But as far as the application process goes, any questions with the forms, just again, you know, give me a call, email me, and I will help you with that.
Perfect. Yep, and that is also helpful for the legislators because it does go through the legislative process. So if we ever have to defend a project, it's helpful if, you know, you have support letters from your delegation and things like that, to make sure they're invested in seeing your project move forward. It always helps. It doesn't happen very often, but sometimes we're challenged if it's a tight budget year, and having your legislator kind of advocate for your project is super helpful. Not a requirement, but just an extra thing. Awesome. Well, thank you all so much for joining us. We're here to help. And like I said, the applications will open up March 25th, and I'll send you all a link since you expressed interest, and just let me know if you're interested in moving forward. And I hope you all have a wonderful afternoon. Thank you all.
Thanks, everybody. Bye-bye.